Hyperbaric medicine has been around since the mid 1600s. At the time, it was for possible relief of respiratory diseases. Today, it is transforming the lives of many patients. In today's medical moment, Camille Whitworth introduces us to Dr. Louis Arencibia with insight to the many modern day uses of hyperbaric medicine.
You've all seen enough of our healthy lifestyle segments by now to know that we have featured the hyperbaric chamber. Well, now, more than ever, patients are coming to get that exact treatment. Dr. Louis Arencibia is a physician in the Wound Care Center, and he tells us how miraculous this treatment can be.
Typically, anybody who has a chronic wound, that usually is a wound that lasts longer than 2 to 3 weeks, that hasn't healed with conventional means, is a great candidate for our wound clinic or any wound clinic. Typical wounds that come under that are venous wounds, diabetic wounds, arterial wounds, pressure wounds are some of the more common types of wounds that we see, and those are usually all very chronic, very difficult to heal wounds. It's very sophisticated. We have a lot of sophisticated dressings. We call them smart dressings. We also have interventions that we do to help clear out some of the old cellular debris that we say, or kind of garbage that the body produces to try to fight off whatever's causing that wound to develop. So hyperbarics has been really interesting. We've been slow for the, somewhat, seeing about 2 to 3 patients for the past year, and then all of a sudden coronavirus, came around, and we've now been busier than ever. I don't understand the correlation, but we're happy to see them. Maybe it's probably because people have more time. It is time consuming because it does require someone to come in every day, 5 days a week, to be able to get the treatments. Unfortunately, there are several other factors. Social factors are one of them. Merely by just not having a vehicle to get to the clinic, that's one. The second, not having the means financially to be able to get that. The other is that they just may have several other factors, confounding factors, that make it difficult to get there. And then the last is just sometimes fear, to be honest with you, of the unknown of what the treatment is, and what it would require for them to get involved and do what they need to do to help them heal. So we're happy to see that, because it shows that there's a bunch of people that have been out there that have needed this, and they're finally coming in to get the treatment that they need. Of course, hyperbarics is fantastic, especially in patients who have radiation-related wounds, or bladder issues, or intestinal issues that are related to radiation treatment. So we have not had any COVID patients, and the reason for that is that we've had an extensive screening process that we do with everybody that walks in the door, from patients to employees. Now I expect that as time goes on that we'll kind of get back to what we used to do, or the phrase that everybody says, the new norm. Hygiene, I think, has become something that's on the forefront, especially in wound care, since a lot of the wounds are related to infection. So it's made us a lot more aware. So I think that in the long run, it's going to help us be a little bit more diligent about, helping wounds heal quicker from that aspect. As far as coronavirus is concerned, other than screening and making sure that we don't invite any patient into our clinics that may have it, it's really business as usual for us. So coming to the hospital has been another interesting proposition that, rightly so at the very beginning, it was something that you really did want to avoid, and part of that was we didn't frankly know how to prevent the spread of coronavirus. Now I almost say the total opposite. The hospital, and in some nursing convalescent facilities, it's probably the safest place to be, only because they have more PPE, they know how to control infection. We're all being monitored by both the state and federal entities like the CDC and DHH, in ensuring that we're providing proper infection control. And we know this is working because we've seen the numbers, decrease drastically by executing these measures.
If you have a wound, the reminder is do not ignore it. The team here ready to treat you successfully and safely.
Thank you, Camille. As always, visit ejgh.org to learn more about the Wound Care and Hyperbaric Medicine Center and its multidisciplinary outpatient care.